Hello everyone, today we are going to talk about the difference between clinical psychologists and other mental health professionals. Please turn on your captions if you have any difficulty following along, and let's get started. First of all, we are going to talk about counseling psychologists, and this should not come off as a surprise after all. They resemble clinical psychologists a lot. They too dispense psychotherapy, and the difference between clinical and counseling psychologists has been reducing over the years. Few researchers have even suggested that this demarcation between clinical and counseling psychologists ought to be ended. Historically, counseling psychologists usually worked in outpatient settings or academic areas but steered away from psychiatric issues. A school psychologist may have a master's or a PhD. They usually look after children at various levels of education and provide them and their parents with the correct form of guidance, emotional as well as educational. They may also apply cognitive tests and provide help in schools which teach children with special needs. They may have a clinic on the side and may be interested in research if they have a PhD. Next, we have psychiatry. And if I had $1 for every time someone asked me which one is better, a psychiatrist or a psychologist, then I would not be making these videos anymore. Psychiatrists are trained doctors who complete their residency in psychiatry. They can use procedures such as electroconvulsive therapy and stick to the clinical side of things. They have better overall expertise, they get paid more, and above all, they can prescribe drugs to patients. However, clinical psychologists are better at psychotherapy. Their education is not as expensive as that of a psychiatrist. Also, psychiatrists earn way less as compared to other doctors, and they also cannot administer psychological tests. Social workers are not the best when it comes to administering tests and performing research, unless they have a PhD. But they can perform psychotherapy and handle administrative tasks. They make sure that the patient get the most out of their therapies. They are the watchdogs of social inequalities in the society and continue to advocate for the betterment of people coming from different sections of the society. Psychiatric nurses know about psychiatric diagnosis, treatments, and also psychotropic drugs. Although, fair warning, you need a prescription if you're going to administer drugs. You may help out in the bigger corporate hospitals or run your own clinic if you want to. Lastly, the word psychologist does not mean we're talking about clinical psychologists alone. There are other subfields of psychology such as forensic, organizational, applied, abnormal, social, etc. They usually do not practice and hence do not need a license for it unless we're talking about an organizational psychologist. They may perform research if they are qualified or dispense their services in relative fields. That's all for this one, guys. I hope you enjoyed the video. Don't forget to like, subscribe, and comment. See you next Monday.